Good morning, everyone. And today we are going to discuss another topic in PTT, and this is medical law or medical ethics. So I have to share you the slide. Okay, and this is about medical law. Okay. So first we have to define what is a medical law. Okay, medical law is the body of laws concerning the rights and responsibilities of medical professionals and their patients. So this covers the rights and responsibilities of a medical professional and their patients. So medical professionals, um, this can be nurses, okay, doctors, and physical therapists. The main areas of focus of this law is confidentiality, negligence, and other torts. And other torts related to medical treatment, especially malpractice, criminal law, and ethics. And this is about also confidentiality. Now, when we say confidentiality, we have to keep all health information and personal information of our patients private or confidential. And this confidentiality has been reinforced and expanded with the advent of Health Insurance Portability and Accountability Act of or HIPAA. And this was mandated by the health insurance portability that all medical professionals and also all facilities, all health professionals will be under this law. And this is a federal law designed to deal with a number of issues pertaining to the nature of our culture, and it creates a number of legal safeguards or other things that protects confidentiality of our patients, medical and mental health. What is negligence and other torts? Okay, negligence is this is a medical professional law that will covers when there is a diagnosis or treatment of a patient that will result to an injury, or the worst is death. For example, it is possible for a medical professional to defame patients if they wrongfully disclose untrue information about the patient's health. So as a health professional, we don't have to give wrong information, okay, to our patient or untrue information, because there are times that we don't want the situation to be more serious when the patients or the family receive this bad result of their diagnosis or bad information. So we tend to give wrong information for them to make them calm, to make them relax, to make them feel comfortable, but that is not right. Okay, that is a wrong action of a medical professional. So as a medical professional, we have to give true information about our patient's health. Another example is battery, and this is torts. When you perform a treatment without any consent from the patient. So let's say you want to give recommendation about colonoscopy. Now, since the patient don't want to have it because this is inconvenient from the patient, they will visualize. Okay, from the anus goes to the colon. They have to insert an instrument. So this patient don't want to submit in this kind of procedure, but still the doctor insists and perform this procedure. Let's say this patient is already old and the family member is not around, and they sedate this patient in order the patient will feel relaxed and later will sleep, and they still continue this kind of procedure without the consent of the patient or the family members. So this is what we call battery, and this is one example of torts. Crime and ethics. Criminal law and ethics have been very large role in the medical law in recent years. So the example here is a patient who is dying or in a terminal stage, and they don't want to suffer anymore. Okay, so they have to let the patient sleep, give a medication, and let the patient sleep. This we call it euthanasia. We have to stop the suffering of the patient, and this is under criminal law. Okay, and another one is sexual assaults against anesthetized patient. So there are patients who have given anesthesia and they are sleeping, and there are medical professionals who are giving or making, sexual assaults against this anesthetized patient, and this is against the law. This is criminal law. So let us go to the code of ethics for physical therapy assistant. What is the code of ethics? The code of ethics is a set of principles and rules used by individuals, organizations to govern their decision-making process, as well as it's a distinction between right from wrong. Okay, so you can distinguish an action between right and wrong. Now let's go to the standards. In standard 1, physical therapist assistant shall respect the inherent dignity and rights of all individuals. So under this standard, we have to act in a respectful manner towards each person, regardless of their age, their gender, their race, their nationality, religion, ethnicity, social and economic status. So whatever they hold, like when they are a man or a woman, a rich, poor, okay, they are in the lower class of the society, they are the elite family or member of the royal family, we have to treat them fairly with no discrimination, and we have to respect them. Now, next is physical therapy assistant shall recognize their personal biases and shall not discriminate against others in the provision of physical therapy services. So there will be no biases. Okay? If one will come to your facility and he is a poor individual and another person comes in your facility and he is a member of an elite family, there will be no discrimination. Okay, everyone should receive the physical therapy services. And standard 2, physical therapy assistant shall be trustworthy and compassionate in addressing the rights and needs of patients and clients. So under this standard, physical therapy assistant shall act in the best interest of patient over the interest of a physical therapy assistant. So as a physical therapy assistant, we have to act on the interest of our client over our interest. 2B, physical assistant shall provide interventions with compassion and caring behaviors that incorporate the individual and cultural differences of patients and clients. So we have to give our intervention, our care, okay, to our patient with compassion. And we have also to remember that these caring behaviors should be incorporated according to the culture of the individuals, differences. If you are from Philippines, if you are from other country, you have different culture, but still we have to give compassion and caring behaviors. Physical therapy assistant shall provide patients and clients with information regarding the intervention they provide. You shall protect confidentiality or confidential patients and clients' information in collaboration with the physical therapist and may disclose only that information to the authorized person when allowed by law or required by law. So you have to only disclose information about the patient when it is required by law. And standard 3, physical therapist shall make sound decision in collaboration with the physical therapist and within the boundaries established by law and regulation. So under this standard, physical therapy assistant shall make objective decision in the patient's or client's best interest in all practice setting. So physical therapists shall make objective decision in patient's best interest in all practice setting. Physical therapy assistant shall be guided by information about practice regarding the intervention. And physical assistant shall make decision based upon their level of competence and consistent with patient and client's values. So we should be competent enough when we are giving our care and doing services to our clients. Physical therapy assistant shall not engage in conflicts of interest that will interfere with making sound decision. So what is conflict of interest? Let's say you have you're working in the Virgin Hospital, and now there is you're offered a higher salary, okay, in another hospital, but you have to work it during your free time. Let's say your duty in Virgil is 6 o'clock until 2 in the afternoon. So you have still time to work in other hospital, but you will still working the same role, okay, as physical therapist, and that is what we call conflict of interest. Physical therapy shall provide physical therapy services under the direction of or supervision of a licensed PT. And you shall communicate with the physical therapist when client status requires modification and establish plan of care. So as a PTA, you have to work under the supervision of a licensed PT. Standard 4, physical therapy assistant shall demonstrate integrity in their relationship with patients and clients, families, colleagues, students, research participants. Now, under this standard, you have to provide truthful, accurate, and relevant information and shall not make misleading representation. So when you are in the workplace and you're dealing with students, those who are doing internship, you have to make truthful uh, information, okay? Accurate information that will not mislead the students or your colleagues. Physical therapy assistant shall not exploit person over whom they have supervised, evaluative, or authorizing. Example, patients, clients, students, supervises, research participants, or employees. Physical therapy assistant shall not engage in any sexual relationship with any of their patients, clients, supervises, or students. So there are students under your supervision. So it's not allowed to have sexual relationship with your students or supervisors. Physical therapy assistant shall not harass, okay, anyone verbally, physically, emotionally, and sexually. Physical therapy assistant shall discourage misconduct by physical therapist and other healthcare professional when appropriate, report illegal or unethical acts, including verbal, emotional, sexual harassment, to an appropriate authority with jurisdiction over the conduct. So as a physical therapy assistant, you have to behave, okay, act as professional, okay, when you are in your workplace and outside also of your workplace. This is to maintain your integrity as a physical assistant. And when you can see or observe your colleague doing this kind of inappropriate action towards another person, you can report, okay, unethical acts, okay, including this is not only verbally but also physical, emotional, and sexual harassment of your colleagues towards another person. You can report this to the appropriate authority. Physical therapy assistant shall report suspected cases of abuse, including children or vulnerable adults, to the appropriate authority. So you can report suspected cases of child abuse because your client is not only elderly or adults. You can have children, especially if you specialize in pediatrics. So when you can observe suspected cases with this involving child abuse, so you can report this to the authorized authority. Physical therapy assistant shall demonstrate, okay, it's already 5. Physical therapy assistant shall fulfill their legal obligations. Okay. Under this standard, they shall comply with applicable local, state, federal regulations. So it's not only locally. Let's say here, it's not only in LA. It can be in the other Emirates. Okay? Whatever is the law that covers physical therapy assistant. Physical therapy assistant shall support the supervisory role of a therapist, okay, to ensure quality care and to promote patient and client safety. PTA involved in research shall abide by accepted standards governing protection of research participants. So sometimes you will be involved in a research study and you should abide on the standard governing the privacy of your research assistant, research participants. Physical therapy assistant shall encourage colleagues with physical, psychological, or substance-related impairments that may adversely impact their professional responsibilities to seek assistance or counsel. 5E, physical therapy assistants who have knowledge that a colleague is unable to perform their professional responsibility with reasonable skill and safety shall report this information to the appropriate authority. So it means that if you know somebody, your colleague, who is not doing their responsibility in the workplace with reasonable skill and safety, you can report this to the appropriate authority. In Standard 6, physical therapy assistant shall enhance their competence through lifelong acquisition, refinement of knowledge, skills, and abilities. So as a professional PT, you shall achieve and maintain your clinical competence. Okay, so how will you maintain your clinical competence? This is upgrading, leveling. Okay, this is getting some certificates who will add to your qualification, or this is enrolling in another course that is related to PT, or we call this continuous professional, okay? Like continuous professional or educational, a training or any seminars. In this way, you can achieve your clinical competence. Physical therapy assistants shall engage in lifelong learning consistent with changes in the roles and responsibilities and advances in the practice of physical therapy. Physical therapy assistants shall support practice environment that support career development and lifelong training. In Standard 7, physical therapy assistants shall support organizational behavior, business practices, and that benefit clients and society. Physical therapy assistants shall promote work environment and support ethical and accountable decision making. So physical therapy assistants shall not accept gifts, okay, that will influence their decision. So let's say somebody will come to you and they want to receive services in their home instead of going to the facility, and they are asking you to do those services, and along with that they are giving you gifts, and this is monetary gift, so that they will influence your decision, but this is not allowed. Physical therapy assistants shall fully disclose any financial interest they have in their product. So it means the services and the product in the facility, you must fully disclose. Give truthful information about the rates, the price, okay, of your products and services. Physical therapy assistants shall ensure that documentation of their interventions accurately reflects the nature and extent of the services provided. Physical therapy assistants shall refrain from employment arrangement or other arrangements that prevent physical therapy assistant from fulfilling ethical obligations to patients and clients. The Standard 8, physical therapy assistants shall participate in efforts to meet the health needs of people, not only locally, but nationally and globally. So under this standard, physical therapy assistants shall support organizations that meet the health needs of people who are economically disadvantaged, uninsured, or underinsured. So you have to meet the health needs of the people in the community, especially those who are poor, those who are disadvantaged, those who have no insurances. Physical therapy assistants shall advocate for people with impairments, activity limitations, participation restriction, and disabilities in order to promote their participation in community and society. Physical therapy assistants shall be responsible stewards of healthcare resources by collaborating with physical therapists in order to avoid overutilization and underutilization of physical therapy services. And 8, the physical therapy assistant shall educate members of the public about the benefits of physical therapy. So it's your role to educate the people in the community the benefits of physical therapy. So let's go to your rights as patient. Okay, what are the Bill of Rights of patients? There are 3 elements: the access to care, patient dignity, confidentiality, and consent to treatment. So the purpose of this Bill of Rights is it makes it easier to the consumer to participate actively in their own health care and to strongly support the importance of good healthcare provider and that of a good provider and patient relationship. This is also to emphasize and support the importance of the consumer's role in making sure that their rights and responsibilities with regard to health improvement. Now, the patient has the right to respectful care given by competent personnel. So you have to hire competent personnel in your facility because it's the patient's right to respectful care. The patient has the right to every consideration of his privacy concerning his own medical care program. So again, it was mentioned here about privacy or confidentiality. A patient has the right to expect that all communication and records pertaining to his medical care should be treated as confidential except as otherwise provided by law. The patient has the right to expect emergency procedure to be implemented without unnecessary delay. So if the case of the patient needs an immediate care or an immediate intervention, the patient has the right to receive that care without any delays. The patient has the right to full information in layman's term. So it means that the patient cannot understand medical terms. So you have to talk to the person, in his own understanding about the terms that you are using, like layman's terms, so that they can understand. A patient has the right to physical therapy services without discrimination based upon their race, their color, their religion, sexual preference, and national origin. And if the patient cannot understand English, she is permitted. She has the right to bring an interpreter in the facility. The facility shall provide the patient, upon written request, access to all information contained in his medical records. The patient has the right of good management techniques to be implemented within the facility out of consideration for the use of patient's time and to avoid the personal discomfort of the patient. The patient has the right to examine and receive detailed explanation of his bill. So when the patient will come to you and ask for the itemize, where does this 100 dirhams goes? Okay, you have to provide a detail, explanation of his or her bill. Now let's go to the appearance and appropriate behavior, how a PT will act and behave. Now there are four main attributes: professional appearance, we have grooming, the correct manners and etiquette, okay, appropriate personal behavior, and how you communicate to your patient. So your appearance, you have to dress professionally, and company policy. So whatever is the company policy regarding uniforms, so you have to follow. Level of customer and client interaction, geographic location. So if you're located in a cold region, then your uniform should be long sleeve. And here in the Middle East, because of their culture, so some government requiring them to cover their hair or using long dress as their uniform. Clothing care and maintenance, appropriate style for your individual body, the types of function you must attend, budget, and purchasing. Now, next is grooming, overall cleanliness, the hair, the nails, the teeth. You can wear makeup, but only slight makeup. And don't wear strong scent of your perfume or cologne because there are clients who are allergic with strong scent. The correct of use of manners and etiquette. Now, first you have to introduce yourself and make appropriate greetings. Being able to initiate and maintain conversation with your clients and colleagues. Respect the customs of others. And being able to express appreciation. That is very important. Knowing appropriate dining rules and protocol, extending courteous behavior to others, and how to behave in difficult situations. For your appropriate personal behavior, respecting the organization and its rules. So you have to follow whatever the rules of your facility, you have to follow and respect. Being a loyal employee, conducting business in an ethical manner, assuming responsibility, and respecting the diversity of people. The next is effective communication. You have posture, facial gesture, neatness, listening, personal behavior, and punctuality. Now let's go to the HIPAA. This is the Health Insurance Portability and Accountability Act of 1996. So under this act, we have the HIPAA privacy rule, covered entities, permitted uses and disclosure, and the HIPAA security rule. So what is all about the HIPAA Act of 1996? This is a federal law, so it's a government law. They create this as to protect the sensitive patient's information from being disclosed without the patient's consent or knowledge. Now, the main purpose of this act is to protect the privacy of patients and healthcare members, to ensure that health information is kept secure and patients are notified of any breaches of their health data. Now, how about the HIPAA privacy rule? The HIPAA privacy rule addresses the use and disclosure of individuals' health information, and we call this protected health information, by entities subject to the privacy rule. And these are called the covered entity. So if you are a member of covered entity, then you are transmitting healthcare or health data of your patient through insurance companies. And the privacy rule will address, okay, this, he will be the one to regulate this information, that even though they are sent through online, but still the privacy will be secured. The health data of the patient will be secured. The privacy rule strikes a balance that permits information uses of information, okay, while protecting the privacy of the people who seek care and healing. Who are the covered entities? So healthcare providers, all healthcare providers, regardless of the size of the facility, even clinics that are small or facilities that are small. Okay, it means small, they are employees, not, they don't reach 50 employees. They are under covered entity. Okay, and the health plans, entities that provide or pay the cost of medical health care. So let's say the health plan is Medicare. So the Medicare will be the one to pay for the cost of the health services. They are under the covered entity. But there is an exemption here, that when there will be only 50 participants and below for that certain health plan, so they are not covered entity. Next is clearinghouses or healthcare clearinghouses, entities that process non-standard information they receive from another entity into standard, or vice versa. In most instances, healthcare clearinghouses will receive individually identifiable health information only when they are providing this processing services to the health plan or a healthcare provider as a business associate. And the last is a business associate, a person or organization other than a member of an entity workforce, using or disclosing individually identifiable health information to perform or provide function, activities, or services for a covered entity. And these functions, activities, or services includes claims, processing, data, analysis, utilization, review, and view. Okay, let's go to the permission, uses, and disclosure. So the covered entity is permitted but not required to use and disclose health information without the authorization of the patient or individual. This is in the following situation. Okay, so disclosure of the individual must, okay, if the information is required or access or accounting or disclosures, the entity must disclose to the individual. So what are those? Treatment, payment, and healthcare operation. Opportunity to agree or object in the disclosure of a private health information may be obtained by asking the individual outright or clearly give the opportunity to agree, acquiesce, or object. Now, incident to otherwise permitted use and disclosure. Public interest and benefit activities. So this is under the privacy rule, permits use and disclose of protected health information without individual authorization or permission. So there are 12 national priorities. So the individual or the patient, even without their authorization, can disclose this following information. First, when it is required by law. Second, public health activities. So this will be disclosed even without the authorization of the client or the patient. Victims of abuse or neglect or domestic violence, health oversight activities, judicial and administrative proceedings, law enforcement, functions concerning deceased person, cadaveric organ, eye, or tissue donation, research under certain conditions, and to prevent or lessen a serious threat to health or safety, and essential government functions and workers' compensation. So let's go to the last, which is the HIPAA security rule. To comply with this rule, all covered entities must do the following. So what are the covered entities again? All healthcare professionals, health plans, business associates, okay? So they are covered entities. So this is what they will do. They have to comply with the HIPAA rule, and all covered entities must do the following. Ensure the confidentiality, integrity, and availability of all electronic protective health information. Detect and safeguard against anticipated threats to security of the information. Protect against anticipated impermissible uses or disclosures, and certify compliance by their workforce. So covered entities should rely on professional ethics and best judgment when considering requests for these permissive uses and disclosures. The HHS Office of Civil Rights enforces the HIPAA rule, and all complaints should be reported to the office. And HIPAA violations may result in civil, monetary, and criminal penalties. So here, if you are a covered entity, you must really follow the rule, the HIPAA rule, or else you will be penalized or you have to pay some monetary penalties, because these are all federal law, mandated by the federal government, and this is the US. Okay, so we are done with the module 3, and so next week we will start again another topic, which is a new module. Okay, topics in module 4.